So deep plane facelift versus a SMAS lift. I think the key thing to understand is that both procedures are a form of a facelift, and both procedures will get you some correction. However, depending upon the degree of correction, as well as some other factors, namely age and the amount of laxity, will determine which is the better procedure for you. The one thing that they have in common is the incision that they both utilize. And for the most part, facelift incisions are normally going to start in front of the ear. It typically will follow the contour of the ear. It will go behind the ear and into the hairline. Now, the only discrepancy will be for males versus females in regards to the location, but for either procedure, you're going to use that kind of incision. At that point, you'll then elevate the skin and the subcutaneous tissues off the SMAS layer. Now, it's at that point that the procedures will become a little bit different. So let's talk about the key differences between a SMAS and a deep plane facelift. With a SMAS, or SMAS lift, which stands for the submusculoaponeurotic system, which is basically just a fine muscle layer that communicates with the lower neck muscles. At that point in time, if you're doing a SMAS lift, you will either tighten the SMAS up by doing what's called a plication, where you take the layers and you fold it over on itself with suturing material to tighten it, or what's called an imbrication, where you will remove a strip of the SMAS, and then once that area is separated, you'll then suture the two ends together and close the gap in the area that you excised. That's one way of doing the SMAS lift. When you go into the deep plane lift, you do incise the SMAS, but instead of just suturing it together, you'll then elevate below the SMAS. You'll also extend that below the jaw, below the muscle called the platysma. With this technique, you'll then dissect more forward, and that allows you to free up various ligaments in the face that are present between the cheek and the skin. There's a muscle called the masseter in the skin, and then an area over the mandible that there's a ligament in the skin. With that, and by doing that, it allows you to free up the tissues more and allows you to get a more robust pull. The deep plane lift obviously involves a bit more dissection. It takes more time, and with that, you're going to get more of a stronger pull. I typically recommend that kind of procedure for individuals who have significant laxity, and normally patients whom are older. Now, not everybody needs to have a deep plane lift. It really depends upon how much correction you're wanting. The area that a deep plane can really get better correction is in the jawline, as well as up here in the upper face area compared to a SMAS lift. Both procedures will give you correction along your neckline, because when you tighten the SMAS up in the face, you're also tightening the muscle below that it communicates with, called the platysma. And so that will help restore and give you correction along the jawline, in addition to getting some pull up here. But by far, the sub-SMAS or deep plane lift is going to get you more correction. So have you ever thought about what the difference in cost is between the SMAS lift and a deep plane lift? With a SMAS lift, the cost of doing that is going to be less than doing the deep plane lift. And that makes sense because the procedure length with a SMAS lift is normally about 3 hours, whereas a deep plane lift is normally going to take about 4.5, sometimes 5 hours. And the reason why, as I've explained in another video, just the techniques involved and what you're actually looking to achieve. From a downtime standpoint, both procedures are going to be very similar. There shouldn't be much more downtime with the deep plane lift or with the SMAS lift. For a longevity standpoint, I think with the deep plane lift, you'll probably get a little bit more longevity compared to the SMAS, just because you're doing a bit more dissection, it takes longer, and you're definitely getting a more stronger, quote, pull. So in regards to, one procedure looking more natural than the other, they both should give you a natural look. I can tell you personally, with my technique and what I'm looking to achieve, I want all my patients to have a natural, non-quote, pulled look. It's really just determining how much correction you want, and ultimately, if you're a candidate for one or both for that matter. But that's something you have to discuss with your surgeon or me. So how do you choose the right facelift for your aesthetic goals? It really depends upon what you're seeking to achieve, but then also what you're showing on your exam findings. And what I mean by that is, somebody who, let's say, is in their mid to late 40s, early 50s, who's going to have a little bit of laxity along the jawline, a little bit of laxity in the neckline. Those patients are more likely going to be a good candidate for considering doing a SMAS lift, as well as possibly a deep plane. Now, if you have somebody who, let's say, in their mid to late 60s, 70s, and there's tremendous laxity in the neck as well as in the jowl area, then at that point in time, I would tell you I would lean somebody to look to do the deep plane lift versus the SMAS. And a lot of that has to just do with it. Most patients are looking to get as much correction as possible. So why would you do the SMAS lift and not the deep plane at that point? But really have the discussion with your surgeon about how much correction you're looking to achieve and what will be corrected. And what I tend to focus on for my patients is getting improvement in the jowls, getting improvement here in what we call the jawline area, as well as in the neckline.